Okay, with that, we'll move on to results from our poll questions. And Francesca, do you want to review the first 4 of those?
Sure. So these are the answers you provided. In your dialysis practice, are any patients prescribed oral vitamin D? It's about a 50-50 split. So 51 of you said yes. 46% of you didn't answer. So among those who answered, the vast majority said yes. To the question of whether you have switched any patients from IV vitamin D to oral vitamin D in the past year, again, excluding those who didn't answer the question, about a third said that it didn't happen, and then about half of those who did said the majority of their patients, and about a half of those said a few patients. This is something, it's a practice I'm interested in looking into more, and if you would like to provide feedback via the comments, I would be really interested, because I would have imagined that the protocols would have changed at dialysis facility in a manner such as most patients who need vitamin D would be using either IV or oral. So the idea of switching, a few patients, it's an interesting one to me, but it might be related to specific clinical conditions of that one patient. To the question, do you anticipate starting oral vitamin D for more patients in the upcoming year? Among the responders, about 50% said no and 50% yes. As a substitute of IV vitamin D is the most common practice. As you saw, there is a relatively small proportion that is using both oral and IV vitamin D, but my guess is that probably there will be a move even more away from such practice with patients on either oral or IV. And then the question that I was really interested in, so for those patients who are on oral vitamin D, do they receive it at the unit, or is it part of their regular prescription for oral medications at home? Again, among those who did respond, the majority said that it's part of the prescription of medications that are taken at home, and 18% of all participants on this WebEx today said that it is given at the unit. I think this is a particularly important one, given that we know that the adherence with the prescription of oral medications at home is highly variable. Now, in the case of vitamin D, this is not particularly burdensome for the patient. It's not like a phosphate binder, but I think it's something to take into account if you start seeing trends towards higher PTH levels or changes in calcium. We should consider what the adherence to the oral vitamin D is. Moving along, Bruce, did you want to look at the second?
Yeah, sure. I'm happy to walk through the others. Thank you, Francesca. So actually we have about 3 minutes to go, and we'll finish up within those 3 minutes. All right, the next question was, have there been changes in your typical dialysis session length in the last year? And actually 50% of respondents said yes, they have increased length. 50% said no change. And roughly within our data, we see essentially the same dialysis session length, on average about 3.5 hours. And I think as noted by Francesca, that is quite short and substantially shorter than we see internationally. It may be that, in looking at the responses here, that there are some units that are starting to increase that towards closer to 4 hours, but this is an area to continue to follow. The next question, have there been changes in your typical blood flow rates? This is for patients with AV fistula in the last year. 20% said yes, increased blood flow rate. The typical blood flow rate is 400 or actually 450 on average, so an increase I'm not sure if that reflects an increase above 450. Perhaps it does. I mean, these are already quite high blood flow rates. So 20% said yes, an increase, and 80% said no change. I think, as also noted, blood flow rates in the U.S. are much higher than elsewhere. In Europe, at roughly 300 to 350 mils per minute, and actually in Japan around 200 to 220 mils per minute. So much higher in the U.S. than elsewhere. And I think we don't understand fully the implications for patients of these quite high blood flow rates. Last two questions actually relate to a topic that we didn't cover explicitly here today, but that we are very interested in as a group and following along with very closely, and this is the issue of incident catheter use among incident dialysis patients. The question was, what proportion of incident hemodialysis patients start dialysis with a catheter in the U.S.? And here we're just asking our respondents to give your best understanding of that number. 20% said 20%. 40% said 40%, and then 40% said 60%, and actually only 20% said 80% of patients. The answer, unfortunately, is 80%. So if we look at data from the DOPS as well as from the USRDS, that will demonstrate quite clearly we're still, believe it or not, still at 80% catheter use among new outpatient dialysis starts. So this is a major, major problem. The folks have done very well with increasing prevalent surgical vascular access, AV fistula in particular, among prevalent patients. We really still have a substantial issue among incident patients, and there are substantial issues related to reimbursement and access to care, et cetera, that are influencing that continued problem that we face. The last question was, what do you estimate is the percent of incident hemodialysis patients in your unit who start outpatient dialysis with a catheter? So how do you actually perform? 40% said there are only 20% of patients with a catheter. Another 20% said there are about 40%, and 20% said 60%. 20% said 80% or more within the unit. So it looks like people are estimating, well, actually generally comparable performance at your own sites compared to the nation. And it may indeed be that what you're reporting here is more a reflection of what's going on at your sites. Hopefully so, but certainly that would reflect care that's far better than we're seeing across the nation at this point. So that's a continued issue that will be followed up closely. Brian, do we have any closing slides? All right, we're at the top of the hour, and so we'll close up the session. So just to note again that we update the DOPS Practice Monitor every 4 months with the next update in August, and we'll have a WebEx soon thereafter in early September as well. We've had a couple additional questions, which I don't think we have time to get to, but we can answer offline. So we appreciate everyone's participation today, and have a good afternoon. Thanks very much. Bye-bye.